What is art therapy? According to the American Art Therapy Association, art therapy is an integrative mental health profession that combines knowledge and understanding of human development and psychological theories and techniques with visual aids and the creative process to provide a unique approach for helping clients improve psychological health, cognitive abilities, and sensory motor functions. The goal of art therapy is always to utilize the art-making process in a way that results in therapeutic healing. What are the benefits of art therapy? To achieve personal insight, resolve conflict, stress relief, catharsis, improve interpersonal skills, manage problematic behaviors, build confidence, reframe negative ways of thinking, and emotional healing. Theories of art therapy, which include psychodynamic, humanistic, psychoeducational, systematic, and integrative. But today we'll be discussing humanistic and psychoeducational. First, we're going to discuss the humanistic approach, which has an optimistic view of human nature and of the human condition, seeing people in the process of growth and development with the capacity to take responsibility for their faith. The humanistic art therapy approaches include phenomenological, Gestalt, humanistic, person-centered, and transpersonal. The humanistic art therapy theories that we'll be discussing today will be transpersonal, otherwise known as open studio, and humanistic. Transpersonal theory. The goal is to experience oneness with the universe. This includes dissolving dualism, a spiritual belief in the unseen. The therapist's role is as a fellow traveler, expanding on their own consciousness and leading to greater service to the client. This includes a non-interfering role of mindful engagement and witnessing. The therapist will also create a sacred space where all truths are welcome. This approach helps the client to get in touch with the deeper part of their self. The open studio approach is based on the following elements: intention, art making, and witnessing. Intention acknowledges that each individual is responsible for deciding what he or she wants to understand, change, or accept about themselves. Only the client themselves can evaluate and set goals. Some intentions could include: I release my judgments about who I am. I am open to self-healing. I connect with my creativity and allow it to lead me. The second element of the open studio process is art making, which is one of the primary ways to refine one's awareness. This also allows the individual to express themselves spontaneously and authentically. The client allows the image to lead them where they're meant to be. The third element of the open studio process is to witness through writing and reading. This is a dialogue between the artist and the art. It's an extremely important part of the open studio process in which the client records everything they experience. The individual's creative process will guide them in its own time and its own way, as each person gains the ability to be open to it. This approach trusts that the client knows what they need to do to reach the ultimate goal. The open studio process is appropriate for high-functioning individuals. Next, we'll discuss the humanistic theory of art therapy. This approach to art therapy is based on a few assumptions. 1. Clients are seen as resolving life problems and not as mentally ill. Clients are viewed as who they are and not as their problems. 2. The client's inability to self-actualize leads to identity crises, which the art therapist helps to integrate into art expressions. 3. Relating self-actualization to intimacy and trust in personal relations and the search for transcendent life goals. In this approach, the client and therapist work together to explore inner images, dreams, archetypes, and to reach a mutual goal. Humanistic includes authenticity, autonomy, and actualization. Creativity is a big part of the humanistic theory because it brings something new into the world. This theory focuses on what's going right in the client's life. The art therapist focuses on creating a non-judgmental environment and helping the client give up perfectionistic standards of performance and behavior. For the client, there is an emphasis on learning to be a single person, one that is able to take charge of one's own life.
The next approach is cognitive behavioral. This is a type of approach that restructures cognitive activity. The voice in your head is a very powerful voice. It has the power to control how you feel about yourself and others and what you do about it. Sometimes these internal messages can be so overwhelming that they result in negative behaviors and a lack of self-control. Someone who feels constant negativity about themselves may feel stuck and unable to make a change because they simply do not know how. Another aspect of CBT is coping skills, which can be taught to the client to help them through difficult times of altering their undesirable thoughts and feelings. The therapist can teach the client tools such as deep breathing and relaxation techniques in order for the client to have a better sense of control. Also, the use of art therapy can be beneficial by letting the client smooth clay or use large repetitious brush strokes when painting. These techniques, along with the use of art therapy, is a way for the client to gain control of their thoughts and feelings, as well as their life, to understand where the negativity stems from and make attempts to transform it into positivity. Cognitive behavioral therapy has been proven effective for treating the following: depression, anxiety, obsessive-compulsive disorder, behavior disorders, eating disorders, ADD, learning disorders, PTSD, phobias, insomnia, schizophrenia. These are just a few of the many disorders that CBT has been proven effective in treating. It's also been proven effective in adults and children, in individual and family therapy in a variety of settings. The next theory is the developmental approach. This is a type of approach that helps the client progress through developmental stages. The main goal is to expand sensory, perceptual, and motor horizons. The art therapist uses art interventions that correspond with the appropriate developmental stage in order to teach their client beneficial things. Working with clients at the earliest stage of artistic expression coincides with Piaget's sensory-motor phase. Clients with cognitive, physical, and/or emotional impairments may express hostility towards any artistic expression. In order to help the client cross this barrier, the art therapist can introduce pre-art materials. A few examples are beads, feathers, yarn, and other materials with different textures. By manipulating these materials, the client can become more comfortable with unfamiliar things. It is also important for the art therapist to introduce each of these materials with different textures while talking to the client about them. This builds trust between client and therapist and between client and the materials. When clients reach the sensory-motor phase and beyond, their artistic growth requires intensive and ongoing intervention to maintain their involvement and comfort with materials. While the client can explore and learn about the world, the art therapist must join in on the play too. This involves a practice of manipulation and refinement of materials by the art therapist in order to fit the needs of the client.